Hello, everyone, and welcome to this month's Northwest ATTC webinar. I'm Jennifer Verbeck, and I'm your host for today. We're excited to have Hallie Burchinal presenting on the power of affirming care in substance use disorder recovery. And we are offering this webinar in partnership with the Washington Recovery Alliance organization. Next slide, please. I just have a couple of quick housekeeping things. First, if you have any questions for our presenter, please type them into the chat box at any time, and we'll try to answer some as we go through the presentation. And then the ones that we don't have a chance to answer, we'll just save those for the end of the presentation. Next slide. You'll also be getting an email that has a link to a survey in it. Please take that survey. It helps us make sure we're bringing you the content you're most interested in, and it also helps us continue to offer free or low-cost events such as this one. That email will also have a link to download the slides from today and a link to our website where you'll be able to find a recording of the webinar, and that should be available later this afternoon or tomorrow. Next slide. We'll also be sending everyone who attends this live webinar a certificate of attendance, and it takes us about a week to get those out. You don't need to do anything to get the certificate unless you're watching this in a group. And if that's the case, please have someone in the group email us within a business day with the names and email addresses for everyone who wants the certificate. And our email address is up there on the slide. It's northwest@attcnetwork.org. Next slide. And now I'll just turn this over to Carly Campbell, who's with us today from the Washington Recovery Alliance. She'll introduce their organization and go over some of their upcoming events, and then also introduce our speaker today. Thank you, Carly.
Thank you, Jennifer. Hello, everyone. Once again, my name is Carly Campbell. I am the Director for Community Engagement at the Washington Recovery Alliance. I'm really excited to be here today. I'm really grateful for the chance to speak a little on our organization. I'm also really happy to be here since the subject matter is both professionally and personally relevant to me. Next slide. So the Washington Recovery Alliance is a statewide nonprofit. It was founded to elevate the voices of people in recovery and to support recovery-focused solutions across the state. I'll be quick about all of our mission and purpose here, so we can move to the next slide. We recognize that recovery isn't just about overcoming substance use. It's about rebuilding lives, strengthening families, and restoring entire communities. We especially recognize that there are challenges in rural areas that often aren't addressed, really unique challenges for the distance, for fewer services, for ongoing stigma. But we also recognize that in rural communities, we see incredible strength. We see people supporting each other and communities that are built on trust and resiliency, which is why showing up for events and for trainings like this one really matter. And because of that, if we can move to the next slide, I'm going to share some events that the WRA has coming up. And we can actually skip all the way to join the movement of a slide. I think it's one more after this. There we go. The other slides are sort of our promotional banners for these events listed here. And you can find more information about each of these at the events website listed here. But briefly, I will give out the invite. Recovery in Action is an event that happens in Seattle, and it leads right into the King County Behavioral Health Legislative Forum, where we talk to local lawmakers. In December, we have an Elevate training. This is a training that helps people who have gone through the recovery process shape their stories for the purpose of talking to lawmakers. And then in February, we have Recovery Advocacy Day, where we actually gather folks together from across the state to the Capitol in Olympia and talk to legislators and lawmakers about recovery-based policies. If you're interested in any of that, we highly recommend you join the movement, such that it is. And next slide. Now that I've talked about the Washington Recovery Alliance, I am going to introduce our amazing speaker for today's presentation. Hallie Burchinal, pronouns she, they, is the founder of CAT Spokane, and now the founder and executive director for the Center for Growth and Empowerment in Spokane, Washington. She has more than a decade of experience in the substance use disorder field, including leadership at Compassionate Addiction Treatment and the CGE's Rainbow Recovery Program. Hallie is passionate about affirming community-centered care that centers on dignity, inclusion, and belonging as an essential element of recovery. And with that being said, I would love to hand it over to Hallie.
Hi, everyone. I'm going to acknowledge that I have some jitters going on, but I'm really excited to be here. I'm Hallie Burchinal, Executive Director of the Center for Growth and Empowerment in Spokane. I'm truly honored to be with you here today to talk about the power of affirming care in SUD recovery. Something that unites all of us in this field is that we all care deeply about people, and that's why we're here together today. Because we believe in recovery, we believe in growth, and in the incredible capacity for healing. Before we get into today's topic, and I'll do this throughout this presentation, I'm really a conversational person and like to interact with people, so I really encourage folks to do that with me. I do best when I'm just speaking and not reading, and right now I'm reading. So I want to invite everybody, before we get into the topic, to take a moment and think about why you came into this work. Was there someone who helped you? A moment when you saw recovery change a life? Just a specific moment in time. I know I have a variety of reasons that brought me into this work. And if you could share that into the chat if you're comfortable. If you're not comfortable, please feel free to hold that to yourself. Since don't have anything showing up in chat, I'll share things that brought me into this work. One is my own recovery story and my struggles within that. I lived rural at the time up in the Colville area, and it was extremely hard to access care and access care that was meaningful to me. I lived a rather alternative lifestyle. And so that was a challenge. And then my own son struggled with addiction and was homeless for 10 years, also rural. He's now doing beautifully today. But he actually played a huge part in inspiring me to inspire CAT here in Spokane. So with that, I'm going to move on. Next slide, please. At the Center for Growth and Empowerment, our mission is to provide affirming, inclusive, and compassionate care that support the healing and empowerment of the 2S LGBTQIA+ community. And I use that entire acronym on occasion because it's one of our board members really pointed out to me that was what drew her to be a board member, was that we were recognizing the full community and not just part of the community. We believe recovery flourishes when people can show up as their whole selves, because healing doesn't happen in hiding. It happens in belonging. When we were developing CGE, one of our first questions was, how do we create a place where people don't have to translate who they are to be understood? One of our early visitors walked in, it was actually a board member, walked in and saw the rainbow art on the wall, and they stopped in that space and they said, I can breathe here. That's what affirming care does. It gives people permission to breathe and to hold space. Next slide. Recovery isn't just clinical, it's a human, cultural, and relational. As we go along, feel free to share in the chat if something connects with your work or if you have a question, and we'll weave those reflections in as we go. If you would like, if you could drop in the chat one word that describes what affirming means to you, that would be really helpful. Kind of a starting point for us all. And I want to step back and read a couple things that came into the chat from my previous question. It just really sheds light on why we're all here, really. Cindy said, it was a full circle moment for me. I'm a social worker and have close family members and associates that struggle with excess drinking and experimented with drugs. I think every one of us has like something personal experience brought us. Paula said the family week at my niece's treatment center was life-changing for the whole family. My niece lived with me for 2 years of aftercare, and then she went home to Philadelphia. At age 37, she is clean and sober, has her own house and business, and is happy. I have my son is working in a lumber yard in Montana now, making more an hour than I make. And it was after 10 years of homelessness. Like, magic really does happen. And for words that mean affirming: safety, acceptance, secure, love, humanity, acknowledgement and awareness, validated, compassionate, accountability, safe place for acceptance. Acceptance and safety come up over and over again. And you are in the right place. Happy you are here. I love that. I really appreciate everybody putting that and embracing. That's beautiful. Something that I've really reflected on is affirmation is active. It's when we're being affirming, we are doing an active thing. It's not a passive thing that we do. Next slide. So let's start with what we know. LGBTQ plus adults are about twice as likely to experience a substance use disorder compared to heterosexual adults. Transgender adults experience SUDs at nearly 4 times the rate of cisgender adults. These are health disparities, differences in outcome that stem not from identity, but from inequity. When people don't feel safe in treatment, they're more likely to drop out early or avoid care altogether. And when care is affirming, when people feel respected, safe, and understood, engagement and outcomes improve dramatically. Let's pause for a moment and think about your own program or space that you work in. What messages do clients receive when they first walk in? What tells them they belong or that they might not belong? Feel free to share anything if you have something you'd like to share on that. I know for myself, when I step into a space, I have a favorite bookstore, a new favorite bookstore that opened in Spokane. And I was walking down the sidewalk and saw the pride flag hanging in the window. And immediately I was like, I need to check this place out. And I made my way back there at a later date and walked in, and there were 2 pride flags hanging to each side of the wall when I walked in. And I just immediately knew I was in a place that I could breathe, that I could relax and sit down and really enjoy myself and be fully present. I'm fortunate that, or is it fortunate? I don't know that it's fortunate. I don't present as a gay woman, and so I don't face some of the stigma that many people face. But even not facing it outwardly, I face it every day in politics and all the other ways in life. And that knowing that I was in a space where I'm welcome, I actually go there for lunch every day now. That's how important it is to me. It's a block and a half from my work, and I go there every day just to sit in that space. So that awareness is really the first step towards reducing disparities, understanding what feels welcoming, and also identifying what gives indicators that we're not welcome. Next slide. So why are these rates higher? There's many reasons behind this, and I'll just touch on a few. We call it minority stress, the chronic pressure of stigma, rejection, and fear of discrimination. Many LGBTQ plus people experience family rejection, they experience social isolation, and too often they experience violence. Even when they seek help, they may not find systems that are ready to receive them. And something important to note, because we all know that history, it takes a while to overcome really significant points in history. Until 1973, homosexuality was listed in the DSM as a mental illness, something curable. That history of pathologizing queer identity left deep scars, and we still see echoes of that today in client mistrust. Another point, and I read this in a SAMHSA report, and again in it was touched on again in another training I went through, and it's something I think we as SUD professionals need to really be willing to hear and look at. SAMHSA did a survey identifying how many programs in the U.S. provided LGBTQ affirming services. So recent research shows that fewer than 40% of SUD programs within the U.S. state that they offer services for LGBTQ plus clients. Even more importantly, of that 40%, only 30% of them actually provided LGBTQ plus affirming services. The remainder of them used it as advertising. And I think that can feel uncomfortable to acknowledge that, but it's very real. So 40% of the programs stated they offered LGBTQ plus services, and of 40%, only 30% of that 40% actually did. This is one of the greatest health disparities that we face. Many treatment systems are still structured through a binary lens. Programs are for men or they're for women. You know, so often we have this men's group on Wednesday, we've got this women's group on Friday. Well, I'm non-binary. Where do I go? Which one do I fit into? Ooh, I lost my thought for a minute. When clients don't see themselves represented, they can feel invisible before treatment even begins, and that exclusion can cause a re-traumatization. So part of what led to the substance use disorder is the trauma of not having a place to fit in, and then you enter into treatment seeking help so that you can live a healthier, happier life, and you're again re-traumatized through exclusion again. For many LGBTQ people, the challenge of who you are, simply existing as yourself, becomes the issue. That's an incredibly heavy burden to carry. When the world keeps telling you something's wrong with you, isolation becomes a survival skill. And when substance use develops, what relationships we do have are often disrupted, deepening that isolation. Then when someone finally enters treatment, that sense of otherness can rise again. Being in a room where you don't see yourself reflected or aren't sure it's safe to be honest can reinforce the same pain that fueled the addiction in the first place. I can't stress enough to you all this impact of stigma. It's not just external, it becomes internalized. Even today, it can still be very difficult to find clinicians who are openly affirming. That single welcoming presence can make the difference between staying and leaving, and between hope and despair. And that's why this work is urgent. That's why I'm here talking today. That's what led to the founding of CGE. Because, and next slide, please. Identity isn't the risk factor, inequity is. I think we so often, as a culture, as a community, get caught up in talking about identity when the real problem is the inequity of having an identity that doesn't fit into a box. Next slide. So affirming care means validating identities and lived experiences. It's about using inclusive, non-stigmatizing language and creating safety and belonging. At its heart, affirming care is grounded in unconditional positive regard, accepting each person fully without judgment or condition. When clients sense that kind of acceptance, safety begins to form, and safety allows honesty. Honesty allows connection, and connection allows healing. For LGBTQ plus clients, unconditional positive regard says, you don't have to earn your worth here. You already belong. If you think back to a time someone treated you with unconditional positive regard, where you felt accepted without needing to explain yourself, how did that affect your willingness to be open? And I see Lisa put in, well, actually, I'm reading back to see what's happening in the chat. We've got some good stuff going on. Paula said, no matter who I see in my office, I thank them for their time, and I have a small frame poster with the words kindness and all its various meanings surrounding it. I become authentically curious and ask questions, no assumptions. That's beautiful. An inclusion without effort. Tessa said a lot of people do that with harm reduction too. It's very sad. And Lisa said, I'd be interested to hear more about your observation about harm reduction. I would love, when we get towards the end, Tessa, if you'd be open to sharing what you've observed and experienced, that would be really wonderful. And it sounds like Lisa would like to hear it. I know I would love to hear it. Yeah, I'm a firm believer in harm reduction, and I know we've got some folks in this room that have so much more experience than I do in that capacity. Okay, catching back to where I am after looking at the chat. Next slide, please. Thank you. So there are 4 guiding principles of affirming care, and we could expand way beyond this, but we just have this short time period. Language and communication, use of correct names and pronouns, and avoid assumptions. I think it's easy for folks that maybe haven't had proper exposure or spent time with folks within this community, but the use of correct names is incredibly important. When someone lets you know their preferred name, you want to be sure to use that name. It's extremely meaningful. And pronouns always. I actually tend to fall back on using they, them, because that leaves things wide open, and I'm not making any assumptions about how a person identifies and who they are at their core. Environment and policy, create inclusive forms, visuals, and if possible, restrooms. I know the building I'm in, I'm actually going to be relocating into another building. Our CGE is, and we're so grateful for that, because the building, we've actually been invited to move into a building that has affirming restrooms. So super exciting. And it's super exciting to be invited to be somewhere. That's something that I can't say we've experienced a lot here in Spokane. So we're excited to get into a space that really creates the affirming sense right the moment you open the door. Clinical practice, be trauma-informed and strength-based, we all know that, and be identity-affirming. Community connection, link clients to affirming recovery supports. And that last one, community connection, matters deeply. LGBTQ plus people are part of a culture shaped by resilience and love. Pride isn't just a celebration. In fact, Pride really is so much more than a celebration. It is a culture. It's a movement. It's been rooted in safety and inclusivity from the very beginning. And it's deeply connected to people's recovery. Recovery and pride aren't separate rooms. They're not separate worlds. They really reside together and intertwine together, and they're both about reclaiming authenticity and belonging. Of these 4 principles, I would love to ask everyone, which of these 4 principles feels strongest in your current work, and which one might need the most growth? Ton says community connection. Environment and policy, clinical practice, communication and language. And Ashley said language and communication and environment and policy are the strongest, and community connection needs more work. And Paula says, hard to say, but clinical practice. I think awareness of creating affirming practices, this is literally where it begins, is taking the time to identify where your strengths are at and then where your weaknesses are at, and being okay with identifying those weaknesses. And then you can step back and start figuring out, how can I strengthen that area so that we truly are providing affirming care. Next slide. So unintentional bias and microaggressions, that can be an uncomfortable topic, but I think the bulk of us that work in this field, we all know that we have to constantly practice self-awareness, and most people that I've met are really willing to do that self-reflection and constantly watch what we're bringing to the table, what unintentional bias we may be carrying along with us, so that we can manage that and reflect and grow as a person, so that we don't carry that over to our clients. But I think it's important to talk about this here today as well. Even with the best intentions, bias can show up. A microaggression might sound like, do you have a girlfriend, when you're speaking to a male client, or using the wrong name after being corrected. It might sound small, but the impact is not. A positive intention does not always equal positive impact. When those moments happen, I think it's really simple, and I imagine many of us do this often. Acknowledge the mistake, acknowledge the error. Take a moment to briefly apologize. Don't overfocus, but do a clear apology and adjust. And by doing that, you're repairing trust. And you're also acknowledging, I'm not perfect, but I'm willing to acknowledge when I've made a mistake, and I'm here with you. And I know in my experience, when I've sat with folks and I've made an error and I give a sincere apology, I've had moments where that ended up being a profound moment for the other person. They may have never really received a true apology, how they're hurt and whether they get, well, I meant a good thing. That's almost reiterating that how you feel doesn't matter. And so I found that a gentle apology and a really truly sincere apology can be a really magical moment for people. I think the antidote to bias really, and it was mentioned in the chat, is curiosity, it's humility, and it's unconditional positive regard, the willingness to meet people with respect, even when we don't fully understand their experience yet. And we may never understand their experience, and it's not their job to give us all that. It really isn't. We don't need to understand in order to accept. What's one small change in language or behavior that could communicate you are safe here to someone in your program? And I'm reading back through the chat while I leave that question there with you all. Oh, Bill in Coeur d'Alene. Hi from Spokane. Community connection is the one needing the most work. I work in Coeur d'Alene. I have had 2 clients in 20 years that were LGBTQ+. I appreciate that you say, so I know I'm jumping backwards, but I really appreciate that you say you've had just 2 clients in 20 years that were LGBTQ+, but 2 clients that matter, right? Because every single person, recovery is, it can be a life or death situation, depending on where that person's at. It can be so many things. And so to be ready in that moment is a special and beautiful thing to have. Like, we want to empower each person that walks through our doors. So I really appreciate that clarification. I'm just reading down. And Paula said, I'm not sure which of the 12 steps this is, but I live by this. When we were wrong, we promptly admitted it. It can be healing for both parties. I feel like I spent 12 years in the rooms in Pennsylvania. I feel like I should be able to quote that, and I can't. I've got menopause brain. It's a little delayed in my thinking ability. My memory is squishy. Okay, go ahead and next slide. Oh, and Bill said addressing LGBTQ+ in our paperwork, it's now missing completely. I think that that's more common than not, truthfully. So affirming care is built through small daily actions. So things that can be done, and we've touched on some of this in the chat. Review your intake forms. Are they inclusive? By inclusive, it's adjustments like asking what are your pronouns, and have an other option so that people can clarify to you what their pronouns are. You're not trying to build it all into the form. Let people tell you who they are. Making sure you're asking what your preferred name is, and making sure that that's centered within your file system so that you use the preferred name and not a name that they may consider a dead name, but it's applied to their insurance. Providing ongoing staff training and cultural humility, which I know we all do. I think getting some folks in to share if it's something that's outside the scope of experience within your program and organization can be important. And here's something I think is, I didn't put this in here, but something I think is important too. Say you've got this beautiful practice going on, and you've got this incredible team of SUD professionals, and one of your team happens to be a member of the 2S LGBTQ+ community. Do they end up becoming responsible for training everybody and letting everybody know how to do all the things? Because the reality is they don't represent all the community. And I think that can be a really thoughtful thing to kind of build into your thought process as an organization, is making sure you don't put the burden on your 1 or 2 LGBTQ+ team members, if that happens to be the case within your space, because now you're putting the emotional burden over onto them. So you want to make sure that they're part of the team. Sure, they can inform and they can share, but they aren't made responsible for how you all work with every LGBTQ client that comes into your space. And that's just being equitable within the workplace, like making sure that this is across the system and not just for clients. Something that I think is a really cool thing to do is attend so when we talked about community and it was identified as building the community connection component for LGBTQ plus clients is really important. Attend an open LGBTQ plus recovery meeting or visit your local LGBTQ plus community center. You don't have to be gay to go. Go to listen, go to learn, go to understand. And then you have a resource that you've walked into that you can share with your clients and give them a true perspective on what that resource felt like, and if it's something you want to refer them to. Or was it healthy? Because not every space is healthy either. And we can walk into those spaces, gay or not, and build those connections and identify healthy resources. Another thing you can do is there is a really wonderful org. You can Google them. It's NALGAP, NALGAP, and that is LGBTQ plus professionals and allies. I think, if I'm remembering correctly, it's $100 for an org for a yearly membership. And that membership goes towards supporting the work that they're doing. They work hand in hand with SAMHSA on building material. They work trying to provide education across systems. They're a really lovely group of people, really well-informed group of people. So I strongly encourage checking them out. And then there's PFLAG that provides support for families and allies. No minority group has ever advanced in society without allies. And we all, as providers, are essential allies. Being an ally it could sound like, tell us what you need so we can help you get there. And again, that's recognizing that we don't know everything, and we're here to help. We're the helpers, and allowing someone to really open up and share what it is that will help them get to where they need to be. And people know themselves, they're able to do that. And I think within our LGBT community, as part of a stigmatized and minority group, oftentimes it feels like everybody really thinks they know what we need to do. And we're invisibilized, we're stigmatized, and empowering that voice is of the utmost importance. I actually remember attending my first LGBTQ recovery meeting. It was here in Spokane. I went to listen. I wasn't there to speak. I really wasn't sure, for a variety of my own reasons, that I wanted to be in that room that day. But I went. And what I found, what really struck me the most, was that I could breathe. I found myself breathing and laughing, and the room laughing together, and a sense of really strong community. And with that, I identified something for me, but I also identified a really beautiful resource that I can share with clients that they can carry with them long after treatment. When we help clients find that space, we're extending recovery beyond the clinical hour, which we all work to do, making sure that people have strong recovery support, strong natural supports in their life. And that can be a little bit more challenging with our LGBTQ plus community. A sad thing that happens in the LGBT community, and it's unintentional, it has to do with safety. Early in the days when we were going back to like Stonewall and all those times, safety was found in numbers and within the walls of bars. And because that provided such a sense of safety and gathering, a place to gather that the general outside world wasn't infringing upon, bars became kind of a centralized part of the LGBTQ plus culture. It's a reality. And not everybody's going there to drink. It truly is it's the safe space. And so when people are entering recovery, it can be really challenging to figure out, how do I connect with my community if my goal is to not drink, or my goal is to not use a substance that may be commonly present in the bar, how do I get that community connection when right now for me, I've identified I can't do that? And so it's really important to explore what those other possibilities are. I know here in Spokane, we've got, and Seattle and some areas are going to have extensively more than we have in Spokane. But we have like Spokane Pride, which is, they're incredible in supporting, and San Spokane for youth. We have Odyssey Youth, and we have a few other resources and a few women's groups that get together and do some things. But the bulk of those things truly end up happening in our local bars because those are safe and welcoming spaces. So I think that's a big part of our work, is finding where can we help people go while they're focusing on their recovery. And next slide. So something that unites all of us in this field is that we all care deeply about people. And our first commitment is to do no harm by continuing to learn, to listen, and to stretch in order to support those who may be different from us. This work is urgent. In our current social and political climate, it has become even more urgent. Every time we affirm someone's identity, we counter a message that tells them they don't belong, and oftentimes worse than they don't belong. I know I'm here as an SUD professional, but I'm also a member of the LGBTQ community. So just prefacing that with this, love is love. Whether we're part of the LGBTQ plus community or not, we can all be allies. Please click next slide. Oh, back one. It just made the words pop up. There you go. Affirming care isn't just inclusion, it's courage, it's compassion, it's love in action. I would love everybody to take a moment right now and identify just one small thing you can do this month to make your care more affirming for your clients, for your coworkers, possibly for yourself. And I think now is the time to make a commitment. It really is. We really are in tough times. There are very few places that are specifically for LGBTQ plus people seeking care. And consequently, we need you all to be a safe space. And I'm reading up through the chat. Just has been amazing. Megan, you're starting up at LGBTQ plus recovery group at 208 Recovery. What city is that in? Oh, right on. That's good to know. If you're okay with it, I would love to connect with you so I could get that information. Because just being honest, I'm reading it here, but I really am struggling with memory challenges. I'm going to forget in an hour. So I hope I pronounced your name right. Mary Lisa says, be aware. Cindy Skies, to make my care more affirming, I can be more receptive to their immediate need. Terry Lynn, ask preferred pronouns. Adriana, this may seem small, but smile at others. I don't think that's small at all. I think smiling at others is a fast way to help people feel seen, heard, and or seen and valued. And Bill, this is huge. Not sure everyone knows that there are over 300 words not allowed on federal agency websites or in applying for federal grants, all to eliminate anything that's considered DEI. Paula says to post a flyer like my kindness one that specifically welcomes LGBTQ. And Bill says just be more informed about which I have so little direct experience. You all, thank you so much for sharing those things. You can go ahead on to the next slide. I want to thank you all so much for the work that you do, for the care, your compassion, and your willingness to grow. I can't tell you, as a person being in Spokane, how uplifting and heartwarming it is to see Bill over in Coeur d'Alene saying what he's saying. That's really meaningful where we're at and the dynamics we often walk through within our geographic area. So Bill, thank you for just really, truly thank you. Together we can make recovery a place where everyone belongs, because recovery grows stronger when it's affirmed. It's a reality. And you all are necessary. And I know that you care because you're here. So I want to thank you for that. And with that, I would like to, is there a way to take everybody off, make it so that everybody can use their mics so that Lisa can share more about the harm reduction aspect?
I can't let everyone, I can only let one person at a time.
Okay. Lisa, are you open to sharing?
Is it Lisa or Tessa?
Maybe it was Tessa.
Okay, hold on one second. Let me
I did say my
you.
memory is bad. It was no joke. Yeah.
Okay, you should be able to talk now, Tessa.
Hi, folks.
Hi.
Hey. Hi, I'm Tessa. I use she, they pronouns. I'm a rehab counselor with the Behavioral Health Department of Santa Clara County. And we're super lucky because we have a harm reduction project embedded in our behavioral health systems, which is kind of unique. As we know, public health has really embraced harm reduction and safer use supplies and this and that. But we actually created this project to help our existing SUD services become more affirming. We have a 2S LGBTQ plus wellness center here, and we have a gender affirming care clinic. So it's a specialty mental health clinic for trans, non-binary, and gender diverse folks that are on Medi-Cal or uninsured, aged 5 and up. So I loved your training because it really couples what we're teaching folks out in the community. I'm literally was just about to drop the Wisdom of Trauma film in the chat because I use this quote as well in our presentation that you have about the question is never why the addiction, but why the pain by Dr. Gabor Mate. So I think just from my personal experience coming into substance use care and working a lot with mandated participants and abstinence-based services, I really saw a disservice we were doing by exiting folks if they have a positive test, using, foul language towards people that use drugs, and it really broke my heart. So I was definitely a harm reductionist from the start and really working in an abstinence-based world where I was like, how can we meet folks where they're at and help them go into other systems or levels of care if that's what they're interested in, or just, as you said, as Carl Rogers has said, accept them, with unconditional positive regard. That's legit what we are trying to do. But I saw so much harm being done within our treatment facilities and in our abstinence-based treatment that I really pivoted into the working with harm reduction and finding that, statistically, folks that engage in harm reduction support are 5 times more likely to enter abstinence-based treatment if they want to, right? And what that speaks to me is all those things we put in the beginning: compassion, love, connection, humanity. That's what we're offering. So when I talk about harm reduction in this aspect of just really universal, we really touch on, we all practice harm reduction. For the specificities of substance use, it can look very interesting and people can be very adverse to it. And the myths of, we're encouraging use, we're this, we're helping people that, ruin their lives and all the rhetoric I've heard in my career. What we're really doing is, providing connection, providing safety, providing information, providing access to inequitable treatment services. Harm reduction was birthed out of like mutual aid and the Black Panthers and public health all coming together saying, hey, we got to help our BIPOC and queer communities because they don't have access to the facilities and the services that we have actually made in our communities. So that's really where harm reduction is. And I always emphasize that when somebody falls out of an abstinence-based program, possibly because they had, a positive test, they're in that harm reduction gap. That's where people are still checking in with it. People are if they're continuing to use, they're, as Gabor is saying, covering up the pain, right? We're trying to help folks, identify that. But universally, just really looking at the silly things like wearing a seatbelt when we drive a car is harm reduction, putting on sunscreen, and really trying to draw people in to understand that the reason we have certain drugs illegal and not illegal isn't because of health. It isn't because of wellness. It isn't this drug is safer than this. It's because of racism and structural violence of why we have these drugs illegalized and why we have alcohol legal, right? So we do a lot of, presentations within our systems to really help, and they've been well received. I was kind of come in like, all right, going into behavioral health, we're going to get a lot of pushback, and it hasn't been. It's just been people haven't had the accurate information, and especially when we're coupling it with 2S LGBTQ plus, IA plus community services, it's a need. We have the binary systems, like you're saying. I'm non-binary. I hear non-binary people come and they're like, they said there wasn't a place for me to go to residence recovery because it's male or female. They want me to conform to my sex assigned at birth. I'm like, this is discrimination. This is exactly the opposite of why all of us got in this field, right?
Yeah.
So it's just, we do a lot of work in our county and we're really lucky. And I hate saying that because I know a lot of counties and states aren't as lucky. But I could go on, but in the interest of time, I appreciate you, those of you that were interested, and I'll drop my email here. We have a lot of great resources and stuff that we can share, even on our website that you can download that really help in terms of bridging that gap between binary set services and making them more affirming or helping them become more affirming to our 2S LGBTQIA plus community, because we're not going anywhere.
Yeah, Tessa, thank you so much for that. And I'm feeling really uplifted right now, realizing I'm not in a room just with people that care about our 2S LGBTQ community, but people that truly embrace harm reduction. Because I actually temporarily left the SUD treatment world as a counselor because I could not come to terms with the way the criminal system was 100% enmeshed into the treatment world, and the constant exiting of people and the lack of awareness that we were dealing with people's lives. Like some folks were struggling with a substance use disorder that they really needed something, that they were there to save their lives. And then recognizing that there's so many different recovery paths and it's not all abstinent based, and that what works for one person doesn't work for another person. And I'm so appreciative that this has become a normalized part of our conversations. Just at least in Spokane. So I'm in Spokane, it's its own world compared to the rest of the west side of the state. But that was a conversation that when I first started talking about it in 2019 was absolutely taboo. And I had folks that didn't want to work with me because I was too radical and I could not understand it. So just being in a space where we're all talking about it and it's not wild is amazing. And I know I'm supposed to wrap this up. You all, thank you so much. I actually wish I would have just started out as a conversation, because that's where the power is at, is just sitting and talking together. If anybody'd ever like to get together for virtual coffee with me and just talk, I would welcome that so much. So thank you all.
Thank you, Hallie. I really appreciate you. And this was a great presentation and very interactive. It was nice to see all the comments and the chat. I just have one little wrap up, and I don't know if we'll have time for any other questions, but if we do, I'll just leave that open. But please remember to fill out our evaluation survey for today's webinar by clicking on the link within the email we'll be sending out. And I also put it up there in the chat box. Hopefully it didn't get buried too much. And be sure to join us for our next webinar on November 6th. It's titled Internet and Gaming Disordered Clients and Some Important Ways They Differ from SUD Clients. And that's presented by Dr. Hillary Cash. And yeah, we have 3 minutes. So I don't know if we had any other questions that have come in. But yeah, feel free to type some questions in. And Hallie, did you have your contact information on any of these slides? We could also put it in with the
You know, I put
Oh,
our
there.
website on there, but
Perfect.
I didn't remember to put my email on there. So maybe
That's okay. We can also just include these slides and any other information you want us to send out to participants in that link that we'll be sending out to everybody who joined us today. Is there any other questions? Ah, perfect. Thanks, Meg. All right. Well, I guess if we don't have any other questions that come in, we can jump off a minute early. But thank you, everybody, for your time and for
Someone in the
joining us
chat
today.
is asking, how do we sign up for next week? I just want them to get that
Oh, great.
information.
Thank you. Sign up for next week for the next webinar. I'm assuming that's what that meant. You can just visit our website and there will be a registration page and a flyer that has more information there. And it's just under our webinars page at Northwest at attcnetwork.org. But you can just Google Northwest ATTC and it'll be under our webinars page. And then if you're on our listserv, you should get a newsletter with that information in there as well. If you haven't signed up for our newsletter, you can visit our website and there's just a button at the bottom that says sign up. So you can do that as well. And then somebody asked about the certificate of attendance. We're just going to be sending those out to everybody who joined us live today. Zoom just logs people's attendance, so we'll get those out in about a week. Did I miss any? I think the rest were comments. Okay. Well, thank you, everybody. We really appreciate your time today.
Thank you, everyone.